Hi, I'm Danіт Яваскі, registered dietitian in the neuromuscular clinic in Schneider Children's Medical Center of Israel. Today we'll talk about nutritional management in Duchenne. We'll talk about nutritional goals, nutritional assessment, weight management, steroid treatment, bone health, common gastrointestinal problems, and nutritional supplements. Nutritional goals include preventing malnutrition, preventing obesity, preventing nutritional deficiencies, improving growth, and improving quality of life as much as possible. Nutritional assessment includes weight, height, and BMI assessment at every clinic visit. Monitoring for overweight and underweight, both can negatively affect respiratory, muscle, cardiac systems. This includes changes in growth curves, even if weight is within the normal range. Assessing energy and nutrient intake, serum vitamin D levels, calcium intake, blood tests, recommending nutritional supplements when necessary, assessing changes in physical activity levels, and a tube feeding plan when relevant. Some contributing factors for weight gain include steroid treatment, which increases appetite often and thus caloric intake. Progression of the disease, loss of muscle mass replaced by fatty tissue, and decreased physical activity, reduced caloric needs. Of course, if we increase energy consumed and we decrease energy expended, this will often lead to weight gain, especially if the patient is newly wheelchair bound. Nutritional management of overweight and obesity is not different from the general population. We will recommend healthy eating habits for the entire family. Here it's especially important not to single out the patient and not to make the patient feel different and make them feel like they have to eat different foods. All the eating habits we recommend are suitable for the entire family, regardless of weight. And it's very important to emphasize that to the parents, to the family. We will recommend family meal times, positive feeding environment. Stressful meal times does not help the situation and makes it worse. We'll avoid using food as a reward. I know with my kids, I separate foods from rewards, and I tell the parents as well, there are enough other ways to reward the kids that you don't need to use food. We will recommend reducing sugary drinks, processed foods, increasing fruits and vegetable consumption, increasing water intake, and helping the patient be in tune to their hunger and fullness cues. I will note here that parents often want to treat their kids, make them feel good in any way they can. They lead especially difficult lives, children with Duchenne, and often this comes out in giving them more sweets and giving them more foods that they like. And here it is important to emphasize that that does not help the situation, and as difficult as it is, and as much as the parents want to treat them and spoil them, it doesn't help the situation. I will also note that it's easier to prevent obesity than to achieve weight loss once already obese. So we will try to stop it as if we see a child already gaining weight more than they should be, then we'll try to stop that as early as possible. I will also note here that it is important to take cultural eating habits into consideration and adapt recommendations accordingly. Israel is a mix of cultures, and it's important to remember when talking to families that something I may recommend may not be culturally acceptable, may not be foods that they even have in their homes. And patients often teach me about new dishes, which is nice as well. We often see a shift from over to undernutrition as age increases. Some contributing factors to weight loss, muscle wasting, eating difficulties, including swallowing difficulties, which may start gradually, and it's important to screen at each visit and to refer to a speech or occupational therapist for a swallowing assessment. And here I will note the advantages of working as part of a multidisciplinary team. Nutritional management of underweight patients includes recommending nutrient-dense foods, small, frequent meals, especially if appetite is affected, oral nutrition supplements when necessary, and texture modification when necessary. And here as well, I would consult with occupational or speech therapist. The general nutrition plan is as well similar to the general population. We are lacking evidence-based nutrition specific to Duchenne. Calorie, protein, fiber, and fluid recommendations are similar to the general population, and it's important to assess these at clinic visits. Calorie intake may need to be decreased or increased depending on weight gain or loss. Steroid treatment often leads to increased appetite. Here we will aim to increase nutrient-dense and protein-rich foods, and we will help guide the families on which foods to increase when there is increased appetite. You can't just tell a kid you're hungry, well, you can't eat. So we will guide them on what to eat and what to increase. It's very easy to add snacks and other empty calories, but we will emphasize the importance of incorporating more filling foods, proteins, veggies, whole grains. There's a risk on steroid treatment of increased blood glucose levels. So here we will reduce sugary drinks and foods high in sugar, as well as a risk of increased blood pressure. And here we'll reduce processed foods and salty snacks and focused on home-cooked meals as much as possible. There is also a risk of osteoporosis, so we will focus on vitamin D and calcium, which we'll get to in a moment. If dietary or physical activity interventions don't achieve weight stabilization, then doctors will consider changing steroid or treatment dosage. A bit about bone health. We will monitor calcium and vitamin D intake. We'll monitor vitamin D levels, blood work. If levels are below 30 nanograms per milliliter or 75 nanomole per liter, we will treat for deficiency. If calcium intake is less than the RDA, we'll recommend increasing calcium dietary intake and supplementation if necessary. Vitamin D and calcium, of course, work together. So if the patient is deficient in one, then it will affect the other and overall bone health. Here I will note that updated guidelines from the health ministry in Israel for now the COVID pandemic, there are recommendations for daily vitamin D supplementation for the general population as well. So I will tell patients that as well. Okay, here are the dietary reference intakes for calcium and vitamin D. As you can see, calcium, the amount we need changes at different stages of life. Teens between the ages of 9 and 18 have the highest recommendations due to rapid bone growth. Vitamin D recommendations, we go according to the recommended dietary allowance. We'll often need to add more than that in order to achieve normal levels. I mentioned that I will try initially to increase dietary intake with calcium, cheeses, dairy products, especially fortified dairy products. And if that doesn't work, then I will recommend a calcium supplement. Some common gastrointestinal problems. The first one I'll talk about is gastroesophageal reflux disease. Risk factors include just the progression of Duchenne. It affects muscles all across the body, including the digestive system as well, esophagus, stomach, all along the gastrointestinal tract. steroid therapy in and of itself is a risk factor as well, and scoliosis. And dietary treatments include smaller, more frequent meals, decreasing dietary fat intake, and also making sure not to lie down immediately after meals. And of course, medical treatment when necessary. Another common gastrointestinal problem is constipation. Risk factors include immobility, lowered physical activity, weakened abdominal muscles, and dehydration. And dietary treatment includes adequate fluid intake. Often patients do not drink enough. I do hear a lot from patients that are wheelchair bound that they don't want to increase their fluid intake because they don't want to have to go to the bathroom more, and so it is difficult. The compliance here is difficult. We will increase dietary fiber as well, but here it's important to increase gradually to have the body get used to it, have the digestive system get used to increased fiber. And here it is very important to have adequate fluid intake in order for the dietary fiber to help. And of course, if necessary, laxatives. Some indications for a feeding tube include malnutrition, weight loss, dehydration, risk of aspiration, and swallowing difficulties. I will note here that a feeding tube doesn't mean that patients can't continue to eat food as well, and it does take away the stress of meeting caloric goals in underweight patients. Regarding other nutritional supplements, many supplements are being investigated as potential therapies in Duchenne. There are studies in mice using various nutritional supplements. I mentioned a few here: branched-chain amino acids, arginine, carnitine, Q10, omega-3 fatty acids. There's not enough evidence for recommendations, at least as far as I know, and further studies are needed. In terms of omega-3 in the diet, the recommendations are similar for the general population to include omega-3 rich foods in the diet. But in terms of in supplement form, parents often ask about all of these, and I tell them that I don't have enough evidence in order to recommend doses, recommend adding the supplements on a daily basis. Here, this chart just sums up nicely the nutritional assessments and interventions. Summing up what I said, at every visit, we'll monitor weight and height. Every 6 months, ask questions, screening questions about difficulty swallowing, constipation, reflux. Annually make sure to check serum vitamin D levels and assess calcium intake. If there are symptoms of swallowing difficulties, then refer to a speech-language pathologist to assess for a swallowing assessment. If there's weight loss and dehydration, malnutrition, aspiration, swallowing difficulties, we may recommend a gastrostomy tube. A vitamin D deficiency, easy enough, treat for vitamin D deficiency. If calcium intake is less than the recommended dietary allowance, then we will recommend increasing calcium dietary intake. And if that does not work, then calcium supplement. And I'll just sum up with when to refer to a dietitian. At the initial diagnosis of the disease, at the start of steroid treatment, when weight is under the 10th percentile or over the 85th percentile, when there are changes in growth curves, again, even if the weight is within the normal ranges, but there are changes, drastic changes within the patient, either lower or higher, difficulty swallowing, and chronic constipation. Here are some of the sources I used, and thank you for listening.